So 999 emergency number is there for people who are in life-threatening emergencies. So people that are experiencing chest pain, people that are experiencing difficulty in breathing, maybe a car accident that we don't know what's happened. It's for those moments in time when people are normally calling us for their worst possible situations and they can feel quite panicked. And it's our call handlers' responsibility to keep those people calm, help them out, ask them some questions and also give them some instructions to help them while we arrange help for them. I always think whenever you dial 999, it seems like we ask a lot of questions, but those are so we make sure that we get the right help and we can send the right response to that person. So we'll ask questions, is the patient breathing? And we'll ask if the patient is conscious. We'll also ask them what's actually happened and also the location. That could be a home address, that could be an industrial estate, that could be on a fast road. So we might ask some additional questions to make sure that we get exactly to that patient as quickly as we can. It's not delaying any help whatsoever. It's making sure that we can get to the right help to the right patient at the right time. So we will ask for make sure that the outside lights are on if it's dark or of an evening, make sure someone is available to meet the ambulance crew and direct them to the patient as soon as possible, but only if it's safe for them to do so. We'll also make sure that we can get their medication or their doctor's details, and then we may give some instructions that actually can help that patient, and it also helps the caller help the person until we arrive with them. Depending on the outcome of the call, it doesn't always require a frontline emergency response. So it may not be somebody who arrives on their own, so what we would call a solo. It may not be a frontline ambulance. When our calls come through, everybody in our dispatch environment will be actually reviewing those calls. Now that might be a clinician, that might be somebody who's looking at the allocation of resource. So what they'll be doing is going through those calls and ensuring that the appropriate resource actually goes to that patient. And depending on the area, depending on the type of resource required, we make sure that we get to the patient as soon as we possibly can with the right type of equipment and the right person. Please only call back 999 if the patient's condition has got any worse, if the location of the patient has now changed or they've moved, or actually if you need to cancel the ambulance. That way we can prioritise our calls and make sure that we get everybody the right help. What we are able to do is to give some live times which are up to date, so that will be across London. That might actually appear to be a long time, but we could arrive much sooner than that. It just gives people an average wait time, very similar to they do in emergency departments.